In various clinics, hospitals, and healthcare centers, providers are communicating, treating, and assisting patients who speak very limited English on a daily basis. On any given day, a doctor, nurse, or aide could be faced with a difficult situation and a patient with a limited ability to communicate. This inability could determine one's life or death. As people of various cultures, ethnicities, and nationalities immigrate to the United States, the role of the medical interpreter becomes increasingly important. The Connecticut Area Health Education Center has a solution.
Hola, mi nombre es Giselle, voy a ser la intérprete de hoy. Todo lo que se diga en este cuarto va a ser interpretado. Por favor, hable directamente con el paciente.
The Interpreting in Health and Community Settings Certificate Program is a 40-hour intensive training that seeks to introduce professionals to the core and essential aspects of medical interpreting.
When I first started with the training, I thought, oh, I've done medical interpreting before for a long time. So I was even wondering, like, I wonder how it's going to be. And after the first class, I realized that everything that I knew, I did not know. I didn't know a thing. And it was like, wow, I have a lot to learn.
Over half of our communication is nonverbal, and this can lead to a trained interpreter to make sure that the client has an appropriate understanding of what the provider is saying. In the case where an interpreter may detect that a client is not fully understanding, the interpreter can ask to make sure and verify that the client does have a good understanding of what the provider is saying or asking.
In addition to interpreting techniques and appropriate ways to guide an encounter, the training also introduces interpreters to anatomy and physiology, as well as understanding traditional cultural beliefs that can hinder a medical interpreting encounter.
Yeah, I think that's a very important issue, which also you learn in the class. And it's the cultures, their beliefs, their ethnicities, their backgrounds. It has to do a lot with how you go on a one-to-one basis on a person. Not everybody is the same. It's different dialogues, different everything. So it does help you quite a bit.
Well, this training is very good. It allows the trained interpreter to realize there's three cultures present when the interpreter is there, which would be the provider, the client, and the interpreter themselves. But the interpreter could serve as a cultural broker, meaning give the better understanding to the provider of certain customs that may be present, and making the provider more understanding of that situation.
As an important part of this training, interpreters are asked to apply what they've learned in role-playing scenarios. These scenarios focus on guiding a medical interpreting encounter, mediating, and applying the code of ethics. Other core components of this training include biomedical practitioners, methods of diagnosis and medical terminology, structure and principles in U.S. healthcare, and the human body.
Hi, I'm Marixa Rosado, the director of the Medical Interpreters Training Program. And our organization is about connecting students to careers, professionals to communities, and communities to better health. So visit our website today at www.easternctahec.org.